Most people, when they think of depression, they normally picture someone who is looking really messy, dirty, sometimes not taking care of themselves, someone who is not waking up, not showering, not socializing, and not being seen to participate in active life. They might imagine someone who is constantly crying, looking sad, and all of that. Someone who is popping pills, someone who is just upset and empty and looks like they have a haunted look on their face. They are not alive. That may be the case for a couple of persons or for some time, a period of time. But there are also people who are going through depression, but when you look at them, you will never imagine that they might be depressed. There is a category that we call high functioning depression. High functioning depression means that you might still be looking like you're getting things done, you're still waking up and being active, doing all the things that you're supposed to do, but you're hiding it so well that it doesn't even appear that you might be struggling and suffering inside. And sometimes you're acting and hiding it so well that you forget to yourself, you forget that actually you do have something going on, some pain going on, but you have probably chosen to bury it somewhere deep, and you just don't want to be reminded of it. And I don't think that depression is something that it comes and then it never goes, or it goes and it never comes. It's a part of life. It's one of the emotions that all human beings face. Just like happiness doesn't always stay. Sometimes you feel excited and optimistic, and sometimes you feel totally empty and down and just dark. And I also feel like sometimes when people look at a person who looks so well put together, someone who is very glamorous, on the outside they look like they have everything. They might look like a supermodel. Doesn't mean that they are not suffering, or that their depression is not real, or that they are faking it, because many people associate depression with having to look like you are depressed. But some people really hide it so well that you will not believe they actually are struggling with depression. And I have reached a point in my life where today I can say that I don't feel that I have to rely on therapy in order to heal. I have had access to therapy and recourse to therapy numerous times in my life, and I'm not saying that it's not good. It has helped me a lot to see many things which I was not seeing, to really break off from unhealthy patterns in my life, and to really also realize that at the end of the day it's just me who has to do the biggest work. It's not the therapist. And I really feel like instead of paying a therapist a fortune to listen to your problems, you can find a friend to do that, and he or she might do it better. And also, as far as medication is concerned, then I don't think that you should, as far as possible, don't become a slave of those pills, and don't let yourself be convinced, first of all, by those people who think that the solution lies in those pills and medications, medical drugs. I'm not against those drugs. Sometimes your situation might be so serious and so real and so difficult that you have no choice except to take medication. But the side effects are really horrible. If you are someone who has an active life, you have to go to work, go to study, and you want to just live life to the fullest and not suffer the side effects, you might want to find other holistic ways to deal with your depression. There are so many things that you could do: working out, praying, meditating, socializing, taking up a new hobby, and vlogging and talking about it, sharing, journaling. There are so many things, and medication is just one option of those unlimited options. Many times you know, I don't know for you, but I have encountered situations where the doctor is really kind of pressurizing me to take medication, and it's as if the doctor doesn't have any faith in me. And it's quite hurtful and quite insulting and quite, how would I say, coming from a doctor. You're not supposed to be really making your patients just swallow pills that's, I think, the last option. Just like surgery is the last option, medication is not the first option. You must try and offer other ways, alternative holistic ways in the beginning to try to cure the patient. And that's also one of the reasons why I feel like most of those psychologists and therapists are really businessmen. They are making money over people's mental health illness, and I know that it can't work for free. But the amount of money they take for that, and the way sometimes they don't encourage you to try to heal from on your own. It's as if they just want to be done with you fast and tell you to go on medication. But I have felt way better without medication. I feel like I'm in control of my life, and I feel like, I don't believe that a pill can do better works than you can do, your own friends can do, your mind can do. And you have to be willing to work to love yourself so much, to the point where you know what you have to do, and you will do it happily, even if it is uncomfortable, even if it is painful. Just like waking up early in the morning is super hard. It's one of the hardest things to do, especially if you're having a sound sleep, you're cozy in your bed, and you just don't want to wake up for all the money in the world. But you have to do it if you love yourself, and you have to extract the maximum of potential from life. Each one day that you have you can never get it back. Each 1 hour, once it is gone, it is gone. And I am honestly, I am trying my best to work on that, and right now I have no doubt as to what I want to do in my life, how I want to spend each day of it, and I'm willing to do whatever it takes to get that. So those are a couple of my thoughts. I have so many thoughts, but I can't express all of them because there are way too many. And I'm probably my problem. I don't know if it is a mental health disorder. Maybe someone can diagnose me, but I keep at night sometimes when I'm too excited about something, or a project, or a study, or a book, or anything that I want to do with my life, or that I have learned. I am so obsessed with it that I can't sleep. At times I feel like my mind is just racing and full of adrenaline, full of cortisol, I don't know. But it's just like I'm so high without taking any drug. I'm so high, and I just keep like, I feel like I am limitless, like in the Bradley Cooper movie, and I just keep thinking and getting all kinds of ideas and inspirations. And sometimes I want to wake up in the middle of the night and write a poem, or write a story, or write a script, or write an idea. And that's just, I don't know if it's a sign of normality, but I totally embrace it, even if it's not normal. There is no need to prove anything to anyone or to be normal. For me, I see a lot of people in the world who are really afraid to be themselves, who really are just following the crowd, who are just surviving. They don't have any fire in their belly. They don't have something that they want to offer to the world so badly, that they are hungry, they are desperate to materialize it, to the point of not really being able to rest until you have accomplished that mission. And before ending, I would like to mention a little quote that has stayed with me forever. A dream is not that which you see while you are sleeping. A dream is that which prevents you from sleeping. So like I was saying, sometimes my dreams prevent me from sleeping. So maybe actually that's a pretty good sign, and I should just listen to my gut instinct, my intuition, and the universe, because the universe will be guiding you and telling you what you should do. And just the law of attraction and all of that. Anyways, let me just stop this video right now, and thanks for watching. I will be seeing you very soon.